Hello everybody, it is Thursday again and this is the infant feeding team at the John Radcliffe. I'm Naomi, this is Alex.
Hello.
And we are doing our usual questions and answers for around about an hour on infant feeding, all aspects of infant feeding. So if you're pregnant and you've got questions, if you have had a baby and you've got some questions, or if you just have questions about any aspect of feeding and you're none of those, that's absolutely fine. We'd love to hear from you. If you can't hear us, let us know, and direct any queries. If you have got any questions about pregnancy related issues, so or your scans or midwife questions, can we ask you to direct them to a different forum? We are midwives, but we don't work in antenatal care a lot, we don't work in labour a lot, and we don't work in the scan departments. And so we do know the answers, but not always the right one straight away. It may have changed with the climate that we're in, so we may not have the most up-to-date information to give you, and we would hate to give you the wrong information. So if you have any questions at all about any of those things, call your midwife or ask a midwife session on this on these Facebook Live sessions is also available.
So we're just trying to get them up on the screen, get this up, so just in case you're asking any questions. So it's been a bit of a rushed morning, hasn't it? We've been doing staff,
really busy day today.
Really busy day. Staff training, so we've been assessing our staff's skills, and they're absolutely fabulous. They've all been doing mock, what we call practical skills reviews, where they talk us through positioning and attachment and hand expressing. And so we've had the staff doing that this morning. We've seen probably about 18 staff today. And we're about to go and meet a whole new cohort of new midwives who've just come in. So it's been a bit rushed today. So we're here, and I'm just trying to get everything up on screen so I can see what's going on.
We also do a session of an update about everything that's changing and topical issues, and also latest research and what's changed and how practice can be improved, or things that they have got questions about involving care for you while you are in hospital to make it a better experience for you. So, we are trying very hard to make everything as cohesive as possible and to make everything so that you don't get the conflicting advice that we do get feedback on, and so that midwives are confident in the care that they give you. And so we are working towards it. We are on an 8-year plan with Baby Friendly, and we are nearly 6 years into that plan, and hopefully we are getting to the end of that journey, and hope that in our journey that we have made, that as you as part of it have seen changes and are happy with your care that you're getting in infant feeding, so that you can be confident as mothers and parents and families in the care that you receive. What else are we going to talk about, Alex?
Well, we've got a question already, but we'll come back to Sarah in just 2 seconds. We were just going to talk about the environmental factors of breastfeeding, really. We always have a little think before we do these sessions about something to talk about that might be of interest to you. And we were just talking about the fact that actually if you're into environmental factors and saving the planet, then actually breastfeeding is probably the best thing you can do. Because if you think about the environmental impact of breastfeeding, it's almost negligible. From the point of view of the impact it has on our environment, there's very, very little waste, neither environmental, so pollutants, there are no pollutants, and from the point of view of landfill, because there are no landfill issues as well when it comes to breastfeeding. You've got to be honest that the packaging is pretty damn special. I mean, lucky babies, they get their mummies, and they're pretty wonderful.
Preheated.
So yeah, at the right temperature, and no waste. And if you think about the energy required, then we anticipate that a mother who is breastfeeding may only need a few more calories, maybe another sandwich in the day, or a yogurt, or a banana. So actually the use of additional energy to feed your babies is absolutely negligible. So it is, if you're into sort of saving the planet, as I hope we all are, and environmental factors, then actually this is the most environmentally friendly way of feeding a baby.
And you save about £800 in that time if you're breastfeeding versus not breastfeeding. So that's quite a nice holiday for a stay away for a family if you are breastfeeding. So the impact of that is worth looking at as well.
I know we've talked before about the health implications of breastfeeding and of not breastfeeding. So a baby that is breastfed is less likely to go and see the GP with problems. They're 15% less likely to see a GP in the first 6 months of life, and 5 times less likely to be readmitted to hospital with gastrointestinal problems. So that not only are we doing a great job for our environment, we're doing a great job for our babies and also the mothers, because there are so many health benefits for mums too. But, to have a look at some of our questions, because I know we've got them coming through. I can see them coming through. So let's go to Sarah. So Sarah has said, not sure if this is the right place to ask, but am I allowed to bring colostrum with me to put in the freezer, or do I need to bring it in a cool bag with frozen pack inside? Thank you.
Good question. Good question. So we encourage mums, if they want to colostrum harvest, to collect their colostrum antenatally. But if you're coming in labour and you're in early labour, you don't know how long you're going to be in the hospital for. So if you bring all of your colostrum in, you've got to make sure that it stays frozen. We have had some problems finding freezer space for your colostrum because there isn't a freezer on the labour ward that you can use with it. And also it has accidentally been lost at times. So we encourage you to just bring a little bit in and then perhaps get your partner to drop some more off once you've delivered, and so that you've got it available, because what you don't want to do is throw it out once it's been defrosted and lose it when you've spent all that precious time collecting it. So yes, we do love you to bring little bits in, but not all of it at once, because it may get all the movement that you do, it may get lost in transit somewhere, or it may end up defrosting. It is quite effective having it in a freezer box with blocks, and it will last probably for up to 8 hours, maybe a little bit more, but I think the best practice is just to bring a small amount with you and then bring the rest in. And also very, very important to remember, if you are collecting lots, because lots of mums do get lots and lots don't get so much, and that's both normal, is that if you're giving it to your baby, remember you've still got to breastfeed, and if you can, and you've still got to hand express and stimulate your breasts, because that's the priming of the prolactin receptors in your breasts that send messages up to your brain to make your milk. And the more you ask your breasts to make milk in the early days, the more milk you will make quickly and secure your supply for later on in your breastfeeding journey.
Yeah, because
so
the milk
don't
production,
put it off.
milk production is driven when you've had your baby and not before. So what you do before is a bonus. Anything you do afterwards is what's going to drive your milk supply. So we have had cases where people have come in with a reasonable amount of colostrum and then not actually carried on, pushing their production, and actually they then had to pay a lot of catch up trying to get their production back up again, because the body's expecting that baby to be at the breast and feeding lots in the first days, and that's what pushes the milk production. So if you're giving some colostrum that you've already got and not actually pushing production, then actually the body goes, I don't need to make so much, and it doesn't make it.
So it's a bit like an after dinner chocolate, if you give your baby colostrum when you've done your own stimulation, it's extra, and that will only protect your baby in terms of calories and getting you through the first few days when your baby's adapting to being outside of your uterus. So don't forget to keep stimulating, even though you've got loads of colostrum, if you bring it in, or even a little bit.
So Sarah, don't feel that you don't not to bring it in, but bring it in a cool bag with ice blocks. It depends on where you go. We do have, as Naomi's mentioned, we do have access to freezers and fridges, but we do sometimes have an issue at tracing that milk down. So if you can, bring as little in as possible, keep it in a cool box, and then hopefully we can use it up. But you'll have done a brilliant job if you end up being still in your freezer at the end of it, because you've done such a good job of feeding your baby in the first few days.
We are working on streamlining it, so but that's the best advice that we could give you at this time.
So Victoria says, hi ladies, not a question but a huge thank you for your advice the other week about my daughter spluttering on her bottle. We tried a new teat and have sat her in a different position, and she's an absolute pro at it now, so thank you. Brilliant. Well, that was your hard work that did that.
Yeah, well done, well done.
Yeah, brilliant, that's nice to know. Fiona has said her baby's 7 weeks old and been using a nipple shield for breastfeeding as it was the only way she could get him to latch, after he ended up having to have a few bottles in hospital when he wasn't well. I'm keen to transition off it just to make life easier, I bet. He's growing well and managed a few feeds without it yesterday. but it was really painful, like I was being bitten, and I ended up going back to the Shield. Is the pain to be expected? I'm pretty sure he had a good latch. Any advice to help us transition? No, the pain is not to be expected. No, Victoria, not to put up with pain. I think we spend a lot, also Fiona, we spend a lot of time saying that pain is not normal. So no, you should not have to deal with pain. It would probably be well worthwhile getting someone to watch your positioning and attachment. I know your baby's 7 weeks old now. So you could try Oxfordshire Breastfeeding Support, and they're still doing their online support, and Abingdon Baby Cafe as well. And it's amazing how brilliant this online support can be. Because with someone filming you putting your baby to the breast, and they can watch it, and we do it too, that actually you can see what our mother's doing, and you can talk her through it, really improving that positioning attachment, and hopefully getting it to a point where it's not painful. But no, it should not be painful. You should not feel like you're being bitten. Yeah, I would suggest contacting Oxfordshire Breastfeeding Support. The reason I'm saying them and not us is that your baby's now 7 weeks old, and our remit is from when they're born to 6 weeks, I'm afraid. So unfortunately, we wouldn't be able to see you to help you with this. But Oxfordshire Breastfeeding Support and the Abingdon Baby Cafe, neither of them have upper limits, and they would be more than delighted. And I'm sure this is something they could really help you with.
And also your health visitor.
Oh yes, and your health visitor.
They have got a specialist, a dedicated infant feeding service, so you could ask to see somebody in that service to support your breastfeeding skills and to improve your attachment. You know, listen to what we're saying about attachment. Look at some, you know, books and things about how the attachment should be. I think we can show you pictures, just because when you're using a nipple shield, you often just pop your baby on the middle of your breast and not in a deep latch. And when he's on the nipple shield, or her, she, I don't know.
I think it was a him.
Was it a
Can
him?
you just check?
Often they go on centrally and not so deeply. What
boy.
you need to aim to get transition from a nipple shield to the breast is that asymmetrical latch, the one that allows your baby to be underneath the breast, and the nipple just skims the top of the gum.
Yeah, in this
Literally
picture.
just skims the top of the gum, and then the nipple will go over the top of the roof of the mouth to the back of the throat, and that the chin is indenting on the breast and the nose is far away, so your baby doesn't even look like it's going to get on there when you start doing that. You look like it's not possible, but actually lining your baby up correctly, nose to nipple. You're very good at demonstrating that, Alex, aren't you?
What, with me? Yeah, so you start, and it's much better because we haven't had to wear masks because we have distanced, but we're doing staff, we have to wear masks. So nose to nipple, and then the baby will go, I really want to be fed, so they go, ah, and they tip their heads back like this.
So this is the head
and then the
tipping
baby
back.
goes, and then the baby goes onto the breast in that movement.
And you have got to make sure that that head is back, the chin is forward, they're sniffing the air, and they're asymmetrical on the breast, so that they are not central, like they may well be on the nipple shield, because you've got used to doing that. So you know, make sure that when you line your baby up, this is where they are when you start, and then when they tip their head back, that's where they end up. So that the nipple is right in the right place for them, so that they can then get the nipple right to the back of the roof of the mouth, and so they're not rubbing the nipple on the roof of on the palate, because it's not right at the back of the throat in the right place.
So that's what we often talk about. So if you have, that's the baby's mouth, the baby's going to come on with the chin and lower lip leading. It's going to hit the breast first. The upper lip is going to just be skim over the nipple, and the nipple is then going to go right to the back of the mouth. And at the back of the mouth, a baby has a soft palate, as do you. If you want to take your tongue back, you'll be able to feel your soft palate. And before the soft palate, you have a hard palate, and this is why people get sore, because the nipple goes into the middle of the mouth. There's a huge big baby's tongue in there, and it hits the tongue, and this is what a baby does. And that's why people get sore. And the gums, I think you were mentioning about being bitten, the gums will be in there as well if they're not getting the tongue over, which they may not be if the head's not back well. So it's really, really important to be in that head back, upper lip just skimming as the picture showed, so that the nipple can go right at the cushion of the soft palate, and then the tongue does this, and the areola can cope with that, but the nipple cannot. And that's what's happening.
So have a look and revisit your positioning and attachment. And you know, when you're using the nipple, you can look at the way that your baby is attaching and see if you can get a deep end further away from the top. So you know, make sure that you get a really big mouthful even with the nipple shield on, so that they get used to doing that when the nipple shield's taken off. And they do get rid of nipple shields when they're ready, not when you want them.
And I think that's a huge progress for you, Fiona,
fabulous.
that he's actually done it, because very often babies are very reluctant when they've got used to something. They don't want to get rid of it, and we were always saying to people the baby will only come off the shield when they're ready.
They will do it when they're ready, and they will do it what they want to do, and don't distract. We lost connection momentarily there.
Sorry about the internet connection
you know,
today.
So just keep trying, but always reward your baby. Don't let them struggle and get stressed, because what you don't want to create is breast aversion and breast strikes. They always get a present when they're breastfeeding. Whatever you do with breastfeeding, give them a present. So they always get milk, they always get something good. So go back to what they're familiar with. If they're struggling, always give them a present, because they will go back to it. That's what they want, and they won't refuse the breast then. So important. But haven't you done well?
Yeah, well done, Fiona. So Jessica has come on, and she's been in touch before. She said, I asked a couple of weeks ago about her 11-week-old exclusively breastfed baby, little boy. He still has really bad tummy, in lots of pain about 2 to 6 in the morning, extremely runny stools. I've been dairy free for 4 weeks with no effect. He weighs 7.2 kilos currently, so desperate for something to help him. So I was thinking about,
Yeah, have you spoken with Latch, or have you spoken with OBS? Has anyone watched you recently attach your baby? Have you seen your health visitor? See if you can get an appointment with your health visitor support team.
We would have thought if that dairy free was going to have an impact, it would have started having an impact by now. We think it takes about 2 weeks for it really to go out of your system. So if that were the reason that you were struggling, then that should have had an impact by now already. So you know, that I would think that's possibly not what's going on. I know we talk about positioning attachment all the time, but it is always worth revisiting positioning attachment. It has such a big impact. 98%
of problems, really. And it may just be that it needs just slightly tweaking. Is your baby close in? Is the chin up? Is it asymmetrical? It's difficult when you've got a big baby, 7+ kilos. That's a lovely big baby that looks like you're doing brilliantly, but frustratingly you're not happy and he's not happy. So it's a really difficult place to be. Have you got an oversupply? Do you have a lot of milk? Do your breasts feel very full still? It could be an indication that he's not quite on correctly. If you've got lots and lots of milk or a really fast flow, it might be worth having a conversation with us on the telephone as well.
Yeah, I think so. I mean, I know I mentioned earlier. Yeah, I mentioned earlier about our remits up to 6 weeks. We're very happy to talk to you. Very, very happy to talk to people if your babies are over 6 weeks. Unfortunately, we can't bring you into clinic though. You know, but a conversation on the phone is fine. And we can signpost you to other help as well, so do by all means ring. You mentioned about him being 7.2 kilos. Well, obviously we don't know, is he growing? You know, we don't know where he's coming from on that, so that might be fabulous. And you've mentioned about his runny stools. Obviously breastfed babies' stools are runny. We expect them to be liquid, but obviously we don't know, are they nice and yellow and liquid, or are they maybe not a nice colour, maybe smelly? So we'd need to know about those sort of things, really. So
they've got mucus in them.
Yeah, so perhaps
are they thick, you know, or are they very runny see-through?
Yeah, perhaps have a chat with us, and I would have a chat with your health visitors and ask to speak to the enhanced breastfeeding team within health visiting and get some more support with that. Hopefully it'll just be reassurance, but if not, hopefully they can help you.
I think it's been really difficult times actually for all mums, because they're not able to meet up with other mums easily. You're not having your coffee mornings that you probably would be having at 12 weeks with your babies, that making new friends and talking to other mums that are a little bit further ahead of you and some that are a little bit further behind. And I think that peer support is really important when you're in your journey of a new baby. And hearing other mums saying that that's what they get as well, and this is what they found help, is something that a lot of mums are missing out on at this time.
Well, that's where the Baby Cafe grew from. The Baby Cafe grew from peer-to-peer support, so, mothers supporting each other, and but having someone there who was able to help with more complex problems, and that was exactly what Baby Cafe grew from, and is still going in Abingdon very well. It's online now, but it's still there. The support is still there. But yes, I think we used to pair people up when they came into the Abingdon Baby Cafe. We would pair them up. We'd meet, you'd meet someone who was struggling and their baby was 3 weeks old, and you'd pair them up with someone whose baby was a week or so older, and and say you two have been at the same place, and you give them people hope that things get better. So
I think they're having some Zoom coffee mornings.
They
now,
are,
aren't they?
yeah.
OBS are having some Zoom coffee mornings where they may have one of the leaders of the session there, but not necessarily for problems, just to be there to support you and to introduce you all together and talk about breastfeeding. And you can make yourself a cup of coffee at home and sit down and chat with other mums that are in the same boat as you, and just meet people, and new faces. And it's really a really important part of your journey as a mother to have that support.
It's just those opportunities to say, this is happening to me, has it happened to you, and what did you do, and is it normal? And looking at what's happening with you, here, Jessica, obviously it's concerning, obviously, that he's obviously not a happy chappy, and you're having this period of time that's really difficult, these 4 hours that are really difficult, and it's just whether this is just normal or whether it's not normal, and it's working that one out, really. So Jessica, give us a shout and we'll have a chat.
Talk it through with us, and hopefully we can get to the bottom of it for you.
Stacey's come on and said, hello, I just wanted to say thank you so much to Naomi for your advice with breastfeeding my baby girl Ella. She was struggling to regain her birth weight, and with your advice she has now regained her birth weight and feeding is going really well. Without your advice I don't think things would have improved as fast as they have. And she's given you a nice smiley face, Naomi.
I give you a nice smiley face back. You should be so proud of yourself. Well done.
That's why we do the job.
Yeah, absolutely.
Olivia has come back. Oops, scooted up. Let me go back, find Olivia. There she is. A bottle-fed baby with bad latch, making a clicking sound when he's feeding is 4 weeks old. We would always suggest to think about the responsive bottle feeding. Thinking about ensuring that he's able to take enough of the bottle into his mouth. If all those things are addressed, then is he growing? Is he dribbling? Is there possibly, does someone need to do an oral assessment? But before that, we would look at how you're feeding your baby, Olivia.
So a little look at responsive.
We'll revisit this
you come in the middle. We are, we do this quite frequently, but it's quite an important part of your feeding that you know how to do this properly. So I hope you can see me. Do shout if you can't. So you can see that there's water dripping from it there, and so it makes the flow much faster. If you turn the bottle on its side and just make sure that there's enough to fill this part of the teat, then the flow stops. Can you see? There's no flow coming out constantly, and this is much less stressful for babies, and it allows the flow to pace itself much more comfortably for babies. So the first thing is to make sure that you hold your baby close, slightly upright, run the nipple down his top lip, and I hope I'm not teaching you how to suck eggs here when I'm going through it, but for everybody's benefit, it's really important to look at responsive bottle feeding, that the baby is responding and it's paced. So you rub the nipple down the top lip, and then you let the baby gape, because doing that with the top lip gets the baby to open its mouth up, and then stick its tongue out a little bit, and then it will accept the bottle into its mouth. And then you might find, looking in your baby's mouth, you might be able to see that the way that your baby's palate is as well. So if they're crying, if you look up, is it a really high palate? Is it a rainbow? Is it, a bit like a cathedral roof? Does it go really high up? All of those are variations of normal. Everybody has different shaped mouth. And it might be that the teat has to go up a little bit more, and that might be why there's a gap. So if you imagine putting this in the baby's mouth, there might be that there's a gap between the top of the teat, and this happens with breastfeeding as well, and the roof of the mouth. So if you tuck it in, it makes a better seal, and that might in fact then make a seal so the baby can create a vacuum when it's suckling, and that might actually help with the clicking if the either flows fast or if it's not quite at the roof of the mouth in the right place. And it might be that you need to try a few teats as well, because sometimes the orthodontic teats help, sometimes they don't. Sometimes the wider mouthed bottles are better. There isn't anything on the market that is like a breast. So
whatever they're
advertising is very clever and very a lot of money is thrown into a lot of these products, but don't be fooled if they say this is the closest to a breast. None of them are. They are bottles, and so the way that the baby suckles is very different. So they have a different mechanism. So you've got to allow your baby to get a really good vacuum. So they suckle and pause, and they suckle and pause with that teat in the mouth. And obviously, as the teat starts to and the bottle starts to empty, you need to turn it up a little bit towards the end of the feed, but you don't need to turn it upright, because you see it's dripping again straight away, and that's very stressful for babies, and they find it really hard to cope with the flow when that happens. So make sure that the bottle is in the mouth far enough. That's the first thing. Have a look at the roof of the mouth and see where the palate is and where you need to direct the bottle up to see if that improves the baby's vacuum in the bottle, on the bottle when it's transferring its food. And just see how your baby's behaving. Does it look away from you when it's feeding? That might be the flow being too fast for your baby. They can't cope with being looking at you and feeding. If it's too fast, they're stressed. So look and see how comfortable. Look at their body language and see how they're coping with the flow that they're getting, and is it too much for them, and are they trying to stop the suckling quite so much. It might be that that is not the right teat for them, and that it's not quite in the right position. But you know, with responsive feeding, paced feeding, the baby will take what it wants, and then when they've had enough, they will spit the nipple, the teat out of the mouth, and they will stop suckling, and they will have had enough. And we do find in clinic, don't we, that babies they will take less when they go to paced feeding from the sort of foie gras, I call it, where they get really fast flow, where the baby gets fast flow all the time. They will take less each feed, because they're taking what they want, not what you want them to have, and that might make a difference. Try it. If you've done all of those things already, and I'm teaching you how to suck eggs, then that's fine. See if you can get somebody to have a little look in his mouth, and see if there is another problem, if there are any other issues. If you want to talk through anything with us, do give us a call. But try doing a bit more paced feeding if you haven't, and see if that improves. And look at the palate, look at the top of his mouth, and just see if the bottle needs to go in a slightly different place to allow a better vacuum. I hope that helps.
Okay, Olivia.
It's a long answer, wasn't it? But I hope it helps.
Yeah, hopefully. All right, good luck with that, Olivia. Fiona, she's come back, and so thank you. Really, really helpful. We'll give it a go and seek some extra help. Brilliant. Good luck with that, Fiona, as well. Right, Rachel has said, my son is struggling to poo daily and is more every other day, but he's so uncomfortable in the day he doesn't poo. Last night his poo wasn't yellow, more greeny, and it wasn't watery, more thick, so should I be worried, or is this normal? We sort of need to know how old he is, Rachel.
And are you breastfeeding or are you bottle feeding? Is he predominantly having breast milk or formula?
Yeah. As that makes a huge difference. So we would expect a baby who's been breastfed to poo on a daily basis up to the age of 6 weeks, and we'd expect that to be yellow. I know that there are some babies that may not always do that, and some babies do seem to store it up and have poonamis on day 2, but it would be a case of having a think about how old your baby is, or letting us know how your baby is, and whether it's appropriate for the age that the baby is. Over 6 weeks, we often find that babies space those poos out a little bit more and may not poo on a daily basis. And we know that babies that are being formula fed won't poo as frequently as breastfed babies do. The gastric emptying of a breastfed baby is half the time for a baby that is formula fed.
So 48 minutes, 48 to 53 minutes it takes to empty a baby's tummy.
Yeah.
So you can see how frequently they need to feed, because they're emptying their tummy, and that's why they tend to poo a bit more frequently. And so, when they suckle, they have a bit of a poo reflex as well going on, so they tend to try and poo when they're breastfeeding. Or having any food, because it's a reflex.
Yeah. So
they tend to do that and be quite noisy, and it doesn't necessarily mean that they are having a problem. It just means that there may be a bit that they are expressing what people feel when they're a bit uncomfortable in their tummy. They don't hold
it in,
and so they will
dramatic.
Say it as it is. So if they have got a bit of a bit of wind and they're feeling a bit bloated, they will tell you. So that might be that they're grunting and they're bearing down and they're making lots of noises, or it might be that they're a bit uncomfortable and squirmy and crying a bit, because it's an uncomfortable feeling momentarily. So it doesn't mean that it's something really seriously wrong with them. It just means that they're telling you what they're experiencing at that time, and every baby is individual.
But we do hear of babies that don't, that I guess they get older, don't feed quite so frequent, they don't poo quite so frequently, and they do often, mums will often say that actually they are a bit uncomfortable on the day in between.
And is your baby reaching its milestones? Is it on the right centiles and gaining the right amount of weight? All of those things are really important when we talk to you about what's happening. And so you need to talk to somebody. It might be that you talk to OBS or talk to your health visitor, your midwife, or you can talk to us.
Yeah.
But you probably need to run it by us and just go through a bit of a checklist with that one.
Yeah, I think age is a big factor on this as to whether we should be concerned or not.
And actually, between 4 and 6 weeks, some babies don't poo after 4 weeks as much, but generally it's about 6. So if it's nearing that time, it might be that their gut's changing slightly and they're not pooing quite so frequently.
Okay, hope that's that one answered. So Livia's come back saying she's doing responsive feeding. Brilliant. So she was teaching
really good.
Teaching you to suck eggs then.
Yeah.
And yes, dribbling. So it might be worth getting someone to have a peek and just have a look in your baby's mouth and to see if there's a problem with your baby transferring the milk effectively.
I'm not sure how old your baby is, Livia. Did you say? I can't remember.
Said. Let me just go back and see if I can see. 4 weeks.
4 weeks. So you can give us a call and we can see what we can do, and whether we can organise something with you for that assessment.
Okay. Right. So Fiona's come back. Another question. No problem. How long would you recommend winding, keeping baby upright for after a feed? Well, your baby's being breastfed through Shield, if I remember rightly. Not too long, really. I mean. Our theory is that there's no air in the breast, so when babies are being breastfed, any wind that they take in is usually from when they're crying, if more than anything else. It's not like being fed from a bottle, so the likelihood is they won't have too much. So just give them the opportunity, have them upright, and exclusively breastfed babies normally would just say, don't spend too long waiting for a burp. That's never going to happen. So, just give them the opportunity. He'll tell you if he's not comfortable and wants to be burped. He'll let you know pretty soon. So not too long, and any upright position does. But would you put a time on it? I mean, just a few minutes.
I think if nothing comes up immediately, as Alex said, then put them down and they will let you know pretty quickly if they've got wind, and then you can pick them up and they'll burp, and then you can put them down again. Yeah. I think that it's there's not many countries spend hours and hours burping babies. I think that it is quite a cultural thing in the UK that babies should be winded. And I think it stems from bottle feeding, and that babies are more windy. So breastfed babies don't tend to need to. They tend to let you know if they're uncomfortable, and often with feeding, that it goes through and comes out the other end, as you probably all know when you've got your baby sitting on your lap. It will come one way or the other, and they will tell you all about it when it's coming.
Yeah, dramatically. Amy has said that her baby boy is 6 weeks old. He's getting up every 2 hours in the night still. Is this normal, please? Quite possibly. It's quite common. They like that reassurance. They like to know you're there.
Might not be the right answer for you, but it is probable that,
Babies, feeding is so much more, and we've said this over and over, so much more than just food. It's like checking in, making sure you're there, mummy. I just want to know you're there. I want to feel you and hear you and smell you. It's you're there, link to the world. You're there, comfort in the world. So it's not uncommon. Hoping your baby's meeting all its milestones, as Naomi says it. Is your baby growing appropriately, pooing and weeing appropriately, and is this just your baby wanting to be in touch with you, really? Some babies might feed lots at night and slightly less during the day. We talk about babies needing a finite amount of milk within a 24-hour period, and some will take a lot of it at night and less in the day, and some will take a lot of it in the day and less at night. But in the night, often trying to think about keeping stimulation low, so having lights right down. You might be doing all this already, only changing nappies if they're dirty. Don't worry if they're wet, because these nappies these days are so great because it wicks the water, the moisture away. They're not going to get sore, so you don't need to keep changing them. Keep, low voices, not too much chatting to the baby at night, and just trying to get it back down again as quickly as possible. But it's
frustrating when you've got friends telling you that their baby wakes once in the night for a feed, and that's not the normal.
No.
You're the normal, and the one that wakes up once a night is not the normal at that age, I'd say. And you can't really get a routine for your baby until they're quite a bit older, maybe 4 or 5 months old. And some babies will wake for feeds until they're 1. That's normal, or beyond that. Some babies suckle all night when they're 2. It's very personal to you as a family what happens. Sometimes your breast capacity is not as great as some other mums, so they can't actually take any more than you can produce for them in that one feed, and it might be that they need to feed more frequently, but they get the same volume at the end of the 24 hours as a mum that might feed 4 or 5 times in 24 hours at that age. So there are no rules in breastfeeding. What you have to look at is the whole picture, and is your baby reaching what it should be doing, and is it working for you as a family? That's more important, how you're feeling about it all. I think if you think that it is normal, then you probably will accept it. If you think that it's not normal, or somebody's telling you that it's not normal, then you won't accept it. And also what your lifestyle is. Are you having to go back to work? Are you, are the things that are pressing you to feel stressed by it? It's exhausting. Being a mum is exhausting, and I think that if everything is normal, then that sounds normal for you. It doesn't help you because you're still going to be waking up every 2 hours, but they will stop doing that.
It won't. It won't.
It feels like a lifetime, 6 weeks, but it's such a tiny amount of time in the whole picture of your baby's growing and getting older.
At this stage, you feel like you're in the middle of a big dark tunnel. You can't imagine there's an end to it, and there is. We promise you there is an end. It will get better, and if you can just see it through, your baby hopefully will start to space their feeds a little bit at night.
It's normal, and then it will change the way that you look at it, and that this is what I'm doing today, and do it one day at a time. And see, and they will tease you. Suddenly they'll go for 6 hours one night, and you'll think, that's it, and then they'll wake back. They'll go back to their 2 hour again, and then they'll do it again, and then eventually they'll go a little bit longer. But not every baby does. A lot of babies do wake up for a lot longer than that.
Yeah, as we say, it's lots more than food. They're often just checking you're there. They just want to know you're there, Mummy.
You're growing their brains.
And I'll have a feed while I'm here, thank you.
You can't spoil them. You're growing their brains.
Eleanor, who we know very well, has been in touch with us before. She says, I think my exclusively breastfed baby is now 5 weeks old. Wow, has bad acid reflux. She struggles to feed comfortably for more than 5 to 10 minutes without seeming to be in pain. Arched back, red face, unsettled. She also struggles to sleep properly. I read somewhere that breast milk can make acid reflux worse due to the consistency being thinner than formula. Is this the case? I don't want to stop breastfeeding, but it is really hard to watch my baby in pain. Could expressing and bottle feeding make a difference? Also, can bad positioning attachment have an impact on acid reflux? Sorry for all the questions. Yes, which one should we start with?
I think you probably need to have a conversation with us as well. I think we need to unpick it all. And just have a chat with you about all of those things. But I think that is it reflux, or is it just that your baby's what we say, a little bit too much fore milk, and maybe not as much fat. So it could be the positioning and attachment. Sometimes you get it right and then your baby grows a bit and the positioning slightly needs to be adjusted again, and getting the right mix of milk throughout the feed is quite important. They can get this lactase overbalance, imbalance, which we talk about quite a lot on here, where if they get lots and lots of lactose because they're drinking frequently at the breast but not draining it well, the lactase, which is an enzyme in the baby's tummy, can't cope with all the lactose which is in the breast milk, and so it has a byproduct while it's waiting to be digested, which is mimics a bit like hydrogen peroxide. It's very fizzy. You have hydrochloric acid in your tummy, so it doesn't sound as bad as it is, but it's fizzy, and that causes a lot of gas and a lot of uncomfortable feeling, and a lot of explosive nappies, and uncomfortableness with babies. And sometimes just tweaking it so that they can drain the breast a bit more effectively can change that behaviour. Some babies shouldn't be screaming after feeds, they shouldn't be uncomfortable.
No.
Is your baby sitting up after feeds, or is he lying him down, and does it get worse when he's lying down, or is he crying when he's at the breast and having the food? Is it the food, or is it the fact that the flow is too fast, or he's not getting a fast enough flow towards the end, and is he choking or spluttering? Because that will tell you a lot about the flow and how he's coping with it. It does boil down to position and attachment nearly all of the time when you've got a baby of 5 weeks that's behaving like this. Genuinely, some babies do get reflux, and they do need to be treated. But a lot of babies need to have their positioning and attachment readjusted to make sure that that's absolutely not the problem first before you start giving medication to your babies through your GP. And I think that it is very hard, and it wears you down when a baby's very unsettled like this. They're quite high maintenance, and they do require quite a lot of your time, particularly in the evenings when they are particularly unsettled. So, lots of skin to skin, maybe wear a sling. Yep.
Did you already say upright positions?
Yes, yeah, you sitting upright before you putting them down.
But also having an upright position of feeding, so the baby's in an upright, upright position. So we've shown that before. An upright position means that it's going to limit if it is an acid reflux, it's going to make it nicer for the baby because it's less likely to happen if the baby's in an upright position. So
is it gulpy noising? Do you hear them gulping as the milk's going down? Are they choking on it as it's going down? All of those things are quite important because they will take a lot of air in when they are feeding like that. If the tongue function isn't particularly good, for instance, and the flow is particularly strong, something like that might make a difference as well. So I think really you need to have a conversation with us so we can unpick a few things with you and go from there. It shouldn't be unpleasant, and your baby should be having a positive experience too.
Okay, good luck with that, Eleanor. You know where we are. You've been in touch before, get in touch again. Rachel's come back. She was the lady asking about the poos. Her baby is 2 weeks old and he's bottle feeding. I say he. I'm hoping he's a he. I'm giving him a gender, and I haven't said. Oh no, son. She did say son. I didn't make it up. So she was saying that she was the one with the more watery poo. So. Have you been discharged by the midwives, because you're only just 2 weeks now? If not, have a quick chat with them. If you're already discharged by the midwives, you should be hearing from your health visitor. If you're concerned about a nappy, I'm always telling mums to hang on to them or take a picture so that you can show somebody what it looked like, because actually it tells us a huge amount from a nappy. They laugh at me here on the wards because I'm going to keep the nappy for me to have a look at, because if you think everything that goes in's got to come out, and it tells you so much what you can look at in a nappy. It can tell us babies are growing, it can tell us, whether they're getting an imbalance of full milk and high milk. It tells us just so
absorbing food.
Yeah. So Rachel, if you are concerned and you get more of these sort of looser, greener stools, take a picture or save one and show it to your health visitor. If you're under them, or show it to your midwife.
And on the formula you're using first milk, normal baby first milk. Just so that they're getting the right concentration, and obviously you're making the feeds up as it says on the tin, 1 feed at a time, and the right dilution so that they are not getting too much or too little of the milk volume. Are you using ready-made or are you using tinned food? And make sure you shake the tin every day when you're bottle feeding, because the fat settles to the bottom of the tin, and so there's much less fat in the top bits if you're not careful, if you've left it for a while, and because the tins are quite big, so they last quite a while, and so give it a good shake every day so that you're giving the right mix all the way through the powder, and that might change the composition of their poo.
But also we know that because the way the powdered formula is, it tends to settle, so not only do you get different components to settling to the bottom because they're heavier, but you also end up with it being denser at the bottom. So another reason for shaking it is that you loosen it up, and that means that when you're making the formula up, It's going to be the same consistency and the same constituents from the top of the tin to the bottom of the tin, because otherwise what happens is you get further and further down the tin, it's much more compacted and you're making stronger formula, and that can result in constipation in babies that are being formula fed. So do always shake your tin on a daily basis, lid on, good shake, and then make up your formula.
Do that before you start changing your bottle, the formula that you're using.
Right, Zoe has said, hello, I think my post got missed. So now I know that I looked last week at back at the comments that had come up, and I know that one came up after we'd finished, or it appeared after we'd finished. So we did miss that one, and I don't know, Zoe, whether it was you, but I'm really sorry. I've tracked all the way back today and can't see another one from you. If you could put another post up, that would be great, because I'm just tracking through the questions we've got on here, and I can't see you this time. So if you put it up last time and we missed it, huge apologies, and please post it back up again. Yeah, pop it back up. Because as I say, I did look last week and realised that one had come back after we'd stopped answering the questions. So please put your question back up. And that's the last post we've got at the moment. So I think we've covered all sorts of things, haven't we? We've covered, formula feeding and bottle feeding,
responsive feeding.
We've covered, we've talked a little bit about acid reflux and the impact of that. That can be it's very upsetting for parents because babies are so unsettled when they have it. Although we feel in many cases it is overdiagnosed. I'm not going to say that's not the case in this one, but we do hear it as an answer for a lot of things, and it isn't actually the case on those occasions, is it? And we have covered about what to expect with poos. So I think, remembering that for those that haven't had your babies or in the early days, we're expecting those poos to change in the early days, go from black in the first 24 hours, then to green and changing, what we call changing stools. So that's much easier to get off the bottom, and then becoming yellow by day 4. And those are nice and easy to get off, and very liquid for the breastfed baby. So
that's our list of from birth to day 5 how it should change, and also the 4 reliable signs of milk transfer. We talk about that an awful lot. How do you know your baby's actually getting enough? Because that's a source of huge concern for parents, particularly if they've been in hospital and their babies have been having top-ups or bottles or supplements of some kind. They've been in a neonatal unit, or they've come back in with weight loss. And we do talk an awful lot about the 4 reliable signs of milk transfer. So the first reliable sign is that your baby is suckling and swallowing. And we talk about this endlessly, don't we?
We do.
And understanding your baby's suckling and swallowing so that you can hear when he's actually or she's actually doing it. And so it might be that your baby suckles and then swallows every 2 suckles or every 1 suckle, and that's when you've got lots of milk. So and it's that noise, okay? So it's not a really big gulp that you're listening for. Sometimes it is, and there's lots of squeaking and stuff going on, and eyebrows lifting, and babies are, making lots of gluggy noises, but that's when the letdown happens at the initial part of the feed if your breasts are very full. But most babies don't sound like that throughout the feed. So, that's the first reliable sign that your baby is getting milk. Is it transferring food? That's one of the things that we look at when babies aren't gaining weight is being able to use their mouth to get food into their tummy. And if they have poor tongue function, or they're not able to suckle because they're too sleepy, then they don't do that, and then they start to lose weight, or they start to become much more unsettled, don't they? Yeah. So so that's the first one. Now, if they're doing that, the next thing that will follow is that they'll have wet nappies. And if you're not sure if your baby's doing enough wee, then take a nappy, a dry nappy, and put 2 tablespoons of water from the tap into your baby's nappy and feel how heavy it is. Yeah. And that will tell you on about, from about day 5 onwards, when you've got more milk in your breast, that's about the right amount of pee that your baby should do about 6 times a day. And it should be clear, and it shouldn't smell. It should be nicely dilute, and it shouldn't smell. So, and the other thing is it shouldn't have things that what we call urates in it, which are little orangey crystals. It looks a bit like brick dust. So before day 5, that's where your baby's getting rid of the sediment in its bladder from, and the crystals from the dehydration in the early days. They will pass what we call urates, and you may see something that looks a bit like blood in your baby's nappy, and actually it's much more orange. That's urates. And beyond 4 days, we don't expect your baby to be doing that, because they should be getting more fluid, and their kidneys will have flushed everything out, the bladder will have flushed everything out, and the function of the excretory system is improved with more volume. So nice clear nappies that weigh about 2 tablespoons of water about 6 times a day, and that will tell you that your baby's transferring enough fluid. And the next one that you would look at is the Changing Stool, which Alex has just described to you, and they should be doing at least 2 £2 coin poos every day until they are at least 6 weeks, and then they start to poo a bit less. They may do massive ones, they may do 3 or 4 little ones and then a much bigger one in the day, but they should be doing them regularly, and they should be they should have quite a substance to them. They shouldn't be see-through like a clear sauce, they should be bitty, so you'll see little bits of fat in them, or look a bit like sesame seeds, and quite runny. And a lot of mums think their babies have got diarrhea. Actually, it's a normal breastfeeding poo, and they shouldn't be offensive, and there shouldn't really be blood in the nappies. Sometimes they're green if the baby's not quite getting enough, or it's getting too much. So that's a bit difficult for parents to gauge on that one. If you are formula feeding, the nappies are much paler and much thicker and much more pasty. And that's because they're excreting a lot of the food that they don't need to absorb, because when they make the formula, they need to put more things in so the babies can absorb it. So there might be more iron in a formula bottle than in a breastfed babies that get very small amounts of iron at this stage. So they excrete that, and the pastiness is the iron that they're excreting in the nappy. So it's paler and it's slightly thicker, and they often don't poo as frequently. They might go once a day, and sometimes they may not go every day as they're getting a bit older. And so you need to just keep an eye on that and make sure everything's okay. They do tend to get more constipated. Breastfed babies don't tend to get constipated, so you shouldn't need to give your breastfed baby anything other than breast milk. It shouldn't need water or orange juice or anything else to make it poo.
Nothing else.
Nothing else at all. It will poo when it poos, and the reason if it's not pooing is probably because it's not getting enough food, and that's very important as parents that you know that. So if a baby doesn't poo on day 3, certainly by the end of day 3, and you haven't seen a poo, you need to be talking to your midwives and asking for someone to come and watch your baby breastfeed, because it may be that you need to increase your positioning and attachment, or you may need to start doing a bit of compression or pumping. And compression is pressing your breasts when you're breastfeeding to just push a bit more in. You may need to have a little bit more support. It's really important as parents that you notice that you take a note of what your baby's putting in its nappies, and you call somebody, because it will lose more weight on day 5 if you don't act on day 3. And what you don't want is to have to come back into hospital because it's lost too much weight. And so if you act on day 3 because you've noticed that the baby's not pooing, you can get help and start to turn it around more quickly and improve your milk supply more quickly, rather than waiting till the midwife maybe comes on day 5 and you're getting help then, and then your world falls apart because she says your baby's lost 13% of its weight, and we need to do more things, and it's much harder to catch up with. So it's much easier on day 3 to catch up with your milk.
We've got 2 questions left, and we're at 25 past.
I've been told.
Yeah, because we've
the last one is weight on the 4 reliable, and if they're doing the first 3, you don't need your scales to tell you.
Yeah, absolutely.
The poo and the wheeze tell you a lot, and
should
the
never.
suckling.
We always say to the midwives, the weight should never be a surprise, because if you've got a good indication of what's happening with poos and wheeze. I've gone back and I found Zoe's post from last week. Because it came through, I think, right at the end and we missed it. So she said, I started producing a tiny amount of colostrum in one breast from week 20, now week 27, so she'll now be week 28, and still only maybe once or twice a week, and only a grain or 2, as it's only one breast and small amount. Would this indicate breastfeeding may be a problem in the other breast at all? Sorry for non-post. Not at all. What you get with regard to expressing is not an indicator of what's going to happen going on. Some women never manage to express in the antenatal period. Some women don't leak ever in the antenatal period. So we assume that if you're able to sustain a pregnancy, then you're able to feed a baby. So if the hormones are there for pregnancy, hormones are there for lactation. So we would always assume you can do it unless proven otherwise. There are a few factors we've talked about on these before, on these programmes before, that may impact on a mother's ability to feed, but it's very, very limited and it doesn't impact on many people. So Zoe, if you have got concerns, we do antenatal conversations. We do talk to people in the antenatal period. We could do an attend anywhere call, but from what you're saying here, just on this, I'm not concerned and you shouldn't be either.
Doesn't indicate anything. It's good what you're producing. That's lovely. It's really positive.
So I'm just going to go back to this week's, because I know that there was another question on here. So let me just find it. Kimberly's come through and said on Tuesday morning she developed a blocked duct, not draining when she fed the children or expressing. Got twins. I think I then developed a milk blister on my nipple, which must have been burst overnight last night, as the blockage had gone by this morning. I've, however, still got a small white patch on my nipple where the blister was. I'm not sure if it will just go if I leave it. It's still a bit painful, thanks.
So you don't tell me how old your babies are, do you? And so quite often you get blebs on your breasts, on your nipples, when your baby steps up composition. The composition of the milk changes slightly, so they have a bit of a growing phase where their milestones are changing and their needs change. So rather than the volumes going up massively, the composition of the milk changes in the breast to support your baby's nutritional needs. And so the milk composition can sometimes be a bit more fatty, or can have different components in it which will clog up your ducts, and some people are more prone to it than others. What happens is the little bleb that you had on is where the nipple's sealed over the top, and it's burst and some of the milk has been able to ooze out. But what you might need to do is a bit of massage, deep sort of massage behind the nipple to see if you can get rid of that little plug. And sometimes pumping and or breastfeeding doesn't do that, but good, it's like Heimlich manoeuvre. You've got to get a bit of pressure behind it to get rid of the blockage. And so, a muslin or a bowl in front of you, and just really work through with a warm, a warm bath or a shower. Sometimes putting coconut oil, organic coconut oil on your nipple, or olive oil on your nipples can make it come out more easily. Massaging that, but a little bit of pressure behind it will often clear it. See how you get on. It's obviously sorting itself out, but it's generally because the composition in your milk changes, and some people are just more prone to having white spots than others, and it's just as it is. If you continually get them, some people say that lecithin supplements can help, and it makes it more oily, the milk more oily, and it can stop them from happening. But I think if it's the first one you've had, it may be that's all you get. Get your positioning right so that you get good latch. And if your babies have changed shape and size, then you might need to just adjust your positioning slightly.
Right, Zoe's been a love and come through with the question again, so we've already answered that. I hope that's okay, and I'm really sorry, Zoe, we missed you last week. I did notice later, as I say, that it had come up. It's just about 5:30, and we're going to go and meet a bunch of new midwives who've just started with the trust. So we're going to go and say hello to them and talk to them about feeding as well. So I think we're going to call it a day now. Thank you for all your lovely questions.
Always fantastic.
Yeah, huge breadth of different things we've covered today. Those that we've suggested to get in touch, please do get in touch. And those that we've said to get in touch with your health visitor or anything, do access that support. Do remember that there is plenty of support out there for you. There's us, there's the Oxfordshire Breastfeeding Support Group, there's Abingdon Baby Cafe, there's your health visitors, and we'll see you soon. Anything to add?
Have a good week.
Yes, and so talk soon. Bye.